Welcome to APTA's Fight the Cut Midday Rally. I'm Michael Matlock, APTA's Director of Congressional Affairs. I would like to welcome our special guest this afternoon, APTA member Linda John. Linda is an APTA key contact, federal affairs liaison, and now a PT-PAC trustee. Wow, Linda, that's a lot of roles you fill for the profession. Where are you from? What's your background? And why did you become an advocate for the profession?
Thank you, Mike. Hello, and thank all of you who are joining us today and all who have already sent in letters to your members of Congress asking to put a stop to these ridiculous cuts. I am a contract therapist for outpatient clinics around the Northeast Dallas area. I graduated from PT school from the University of Oklahoma 20 years ago and have been involved in legislating or in advocating for the profession ever since. Serving, as Mike said, as a federal affairs liaison for basically my entire career, and have recently been appointed to serve as PT-PAC trustee. I'm not sure I can pinpoint an exact event that made me want to get involved initially. I was active with youth and government in high school and volunteered with political campaigns from an early age. But going through direct access battles right out of PT school, I quickly learned how important it was to advocate for my new profession. So not only have I always felt advocating for physical therapy was a professional obligation, I have also always felt I could make a difference for my patients by ensuring they have the ability to access good quality, cost-effective care.
We appreciate that. Why is it so important that members of Congress hear from PTs, PTAs, and students regarding healthcare policy?
Well, again, we have to get our message to our members. It is our job to educate legislators on issues that affect the physical therapy profession and the patients we serve. Legislators come from very varied backgrounds and occupations. They see thousands of bills each year, and they count on the experts in the field to educate them on the impact of those bills. So if your legislator is not a healthcare provider by profession, then all they know is what they hear from others, meaning if they're not getting our message from us, they're getting someone else's version of our message. This is certainly not what we want. And it is our job to make sure they hear from all of us on the important issues that impact our profession and our patients.
Yeah, that's totally true, Linda. I know firsthand when I see members of Congress, they have no idea, many of them, unless they've had physical therapy themselves, what these policies that they're creating up on Capitol, how it affects our patients and our members. So it's really important that they hear from us. Today is a big day for our members and patients to advocate against the 9% Medicare cut, which impacts our clinics, Medicare beneficiaries, TRICARE, and veterans. Why do members need to fight the 9% cut and contact their legislators about this issue today?
Well, these are critical times for us. I mean, there's never a good time, but in the middle of a global pandemic is certainly not the time to reduce payment to Medicare providers. Our profession cannot sustain another payment cut. We're already coping with the 2% sequestration cut on top of the 50% practice expense cut from MPPR, and now looking at the upcoming proposed 15% cut for services provided by PPAs. An additional 9% cut will be devastating to those practices who will be, still trying to recover from this pandemic. Everyone across the country, so many groups are trying to get their piece in the next COVID package. Members of Congress are hearing from all of these groups every day. The only way we get our message to Congress and make that message important to them is to do this in very large numbers. This is the only way to let them know how many of their constituents these cuts will affect. We have to let them know the instability to the healthcare system that will result if these cuts go through. We have to be loud. If you get a chance today, check out the story written by Mark Ritz on the APTA website about how all of this is affecting his private practice. It's a absolutely heartbreaking story, and it's one that is so familiar for many of my friends who are losing their practices or have been furloughed or lost employees because they just simply can't pay them. Regardless of your practice setting, regardless whether your facility bills under Medicare Part B, these potential cuts will have a devastating impact on the profession as a whole. And we need your help to ensure your patients, your friends, and your family members continue to have access to physical therapy services. It literally takes 2 minutes to go to the APTA website, click that Take Action tab, share this information with your friends, your colleagues, your neighbors, your family. We can't be silent. We got to let this done. We got to get this done. We got to get this done today. And for those of you who have already sent letters out today, thank you, thank you, thank you, and happy football season.
Thanks, Linda. I mean, you're totally right. We had hoped that CMS, they had this policy, put it out there over a year ago, and no one ever thought, even members of Congress didn't think they would go through this when after the pandemic hit, but they went through with it. And so right now, we need to continue to send letters to CMS, but Congress really has to step in on our behalf, on behalf of our patients and our clinics, to really move things forward. Thank you, Linda, for your advocacy, and we appreciate all you do for the profession. You can be an advocate too. It only takes a couple minutes of your time. Our goal today is to send 50,000 emails to members of Congress. Currently, more than 11,000 emails have been sent to members of Congress. This morning, APTA members received an email providing direct links to take action via emails to your legislator. Take action now. We all can do it. Also, a link was provided to our Patient Action Center to allow patients and non-members to contact their legislators too on this issue. Please share it with them. And if you did not receive any of these emails, you can go to apta.org, and there is a box right there to take action so you can contact your members of Congress via email. Let's not be silent. Our voices must be heard in the halls of Congress. Don't forget to join us for our next rally update at 6 p.m. Eastern. Thank you again for your advocacy for your patients and our profession. Have a great afternoon.